In 4 days now, COVID-19 vaccines will be available to even more Georgians. The governor announcing anyone over the age of 55 will be eligible to receive a shot on Monday. Also, those 16 years old and older with high-risk medical conditions. That includes everything from asthma, cancer, diabetes. The governor also saying there is enough supply, that if there's enough supply, everyone over the age of 16 could be eligible for a vaccine by next month. But it comes at a critical time, with the CDC ranking Georgia the slowest in the nation for vaccine rollout, for getting shots into arms. Mara Siriani joining us live now. And Mara, experts say there are a few things holding us back. We're really curious about this. Why are we last in the nation?
Well, Sheba, as we know, different states really are moving at different speeds here. So Georgia recently expanded vaccine eligibility to include educators and school staff. And one other issue is that getting supply to where it needs to be. Expanding the eligibility pool in Georgia is good news, but it could come with potential consequences.
We don't want to create such demand that we have, the horror stories that we saw in other states of long lines, but we also don't want to have supply sitting out there with not having the demand for that supply.
Governor Kemp Wednesday defended the state's vaccination efforts. The CDC, however, says Georgia still has one of the lowest vaccination rates in the country. According to the latest CDC data, the majority of states have already given out 86% or more of first doses, while Georgia is sitting at below 70%.
I think that a big challenge that Georgia is facing is making sure that they're matching up dose supply to where it's needed.
Public health expert Amber Schmidt says monitoring vaccine appointment availability could help speed things up.
There's virtually no vaccine appointments available in the Atlanta metro, but there's lots outside of the Atlanta metro. And so what that shows us is that there's more demand inside the Atlanta metro and maybe not so much elsewhere. And so maybe the doses need to be moved around.
Other possible solutions include expanding eligibility to essential workers, targeting remote areas with mobile vaccine efforts, and more rural areas where transportation is limited, and again, making sure folks are able to make an appointment. Now, Governor Kemp says they're also using data from those GEMA mass vaccination sites, again, to get those vaccines to the sites where they need to be, where demand is the highest. He also says they're working to promote that single dose J&J shot.
All right, Mara, thank you. If you are 55 or older and have already pre-registered with the state's vaccination website, they say you don't need to follow up. But for those 16 and over who are now eligible, you can register starting Monday at 6 a.m. For a link to that website, as well as a list of medical conditions that could now qualify you for a COVID-19 vaccine, visit 11alive.com.